Okay, so I'm going to go ahead and do the newborn assessment here. This is my newborn. Upon entry into the hospital and into the room, I would go ahead and wash my hands. For the purposes of this video, I'm just going to simulate that using hand sanitizer. The first thing I want to emphasize here is that I am going to be placing this child, which I have already done this, in a warm environment. We're going to pretend like this is a heated environment. Thermoregulation is extremely important for infants, so we want to make sure that we keep everything warm, including our hands and our stethoscopes. So I'm going to warm my hands. As I'm warming my hands with my stethoscope, I'm just going to observe the infant for some normal things that they should be displaying. So it should have symmetry on both sides, should have flexion at the elbows, knees, and hips on both sides in a symmetrical manner. And this is going to be a he does. The next thing I'm going to go ahead and do is listen to the infant's heart rhythm. So the infant's heart rhythm is supposed to be anywhere from 120 to 160 beats per minute. And I'm going to listen in the apical pulse region, but I'm only going to listen to it for a few seconds for the purposes of this video. However, in real life, it would be a full minute. And then at the same time, here I'm going to be looking at the infant to kind of see if they're in any sort of respiratory distress. So I'm looking for movement of the chest as well as the abdomen. They are diaphragm breathers, so you will see the abdomen moving. It appears that baby is moving well in terms of respirations. And then the normal respiration rate for an infant is 30 to 60 beats per minute. So I'm going to go ahead and count that. You would count that also for a whole minute. For the purposes of this video, I'm just going to go ahead and observe for a few moments. And baby appears to be breathing normally. The next thing I'm going to do is go ahead and listen to breath sounds. So the main thing we're looking for there is any crackles. That's indication of fluid still in the lungs. Baby's lungs are really clear, so we're good there. Then the next thing is going to be listening to the abdomen. I'm going to listen for bowel sounds in all 4 quadrants. This should be about 30 seconds per quadrant. However, for the purposes of this video, I will go ahead and just listen for a few seconds. Bowel sounds are all present. If they were not, I would listen in that specific quadrant for at least a minute, just to observe to make sure they're truly absent. The next thing I'm going to do is observe the infant's lips and mucosa from a distance here. You just want to make sure that they're pink and moist, and infants' mucosas are pink and moist. The next thing I'm going to do is assess the skin. So for this skin, you want to make sure that it is smooth and soft. Sometimes they'll have extremely dry skin or different, not necessarily abnormalities, but depending on their gestational age, they might have some differences, some like cottage cheese looking, substance on them, stuff like that. Baby is full term, looks good, skin is smooth and soft. Then I'm going to go ahead and assess skin turgor here. So I'm just kind of pulling on the side of the abdomen here to check that. And baby is not dehydrated, so we're good there. Next thing I'm going to do is look into the baby's eyes. Jaundice is very common for infants, so I want to make sure that the scleras are not tinged with that yellow and they don't have jaundice, and baby looks good. The next thing is going to be kind of obtaining some measurements of the baby. We want to get a head measurement, sometimes a chest measurement, as well as weight and length. I do not have a measuring tape with me today. For the purposes of this video, we're going to pretend like I do, and I'm just going to kind of voice where I would go. So for the infant's head circumference, you kind of want to go at the widest part of that head, usually 1 to 2 centimeters above the eyebrows, and you want the biggest or largest part of the back of the head and kind of the front of that head, and you would go around from the frontal or the occipital to the frontal region. And then for the length measurement, you want to make sure that baby is all spread out. So you would in fact spread baby out and kind of get that head to toe measurement in centimeters. And then for weight, it would be on a scale in grams. So I have successfully measured the head, length, and weight of the child, and then I would plot it on, say, a growth chart to kind of determine whether or not they fall between that 10 and 90 percentile. The next thing I'm going to go ahead and do is palpate the infant's head to check for those fontanelles. Those are very important, so we want to make sure that they have that posterior and anterior fontanelles. Palpate along the suture lines here. Support baby's head. And baby does have the anterior and the posterior fontanelles, and the sutures don't seem to be overlapping or anything like that. In terms of the hair, I was just kind of observing the hair here. Baby's hair is silky and fine. Another thing that you can kind of come in contact with when you're observing the infant is molding and caput. And basically what that is you either have some fluid in the brain, or from the actual birthing process, they will come out with some kind of a deformed head, a little bit like cone shape. And those are kind of not necessarily abnormal. They can be expected findings and should go away. Next thing I'm going to do is go ahead and look at facial symmetry. I want to make sure that both sides of the face are symmetrical. Looking at eye placement at this point, it is often common to see that when a baby is born, they kind of appear to have strabismus. Sometimes it's not true strabismus, so I would be looking at those epicanthal folds to make sure, kind of see the center of those eyes and see whether or not they have an excess of those folds to determine whether or not it's true strabismus or not. Baby does not have strabismus. Not true strabismus. Eyes are blue. There's facial symmetry on both sides. And the next thing I would go ahead and do is check for constriction of pupils. So I'm going to go ahead and shine a light in baby's eyes. This is just kind of checking to make sure that they are reactive to light. Okay. Both eyes there did go ahead and constrict, so we're good there. Next thing I'm going to assess is the baby's ears. So for the baby's ears, you want to make sure that the ears are basically kind of in line with those eyes. So you would go from the inner outer canthus of the eye up to the pinna of the ear, and those should be kind of like a direct line should be able to be drawn. Any low set ears can be indicative of some sort of genetic anomaly. Sometimes it can be just a parent factor, like both parents have low set ears or something. Baby in this case looks good. So I'm just going to go ahead and simulate how I'd go ahead and do that. So again, looks good there. I'm gonna go ahead and take a look in each ear here, just to make sure that cartilage and everything is in place and that there are no abnormalities in the actual ears. Looks good there. Next thing I'm going to go ahead and do is look at the symmetry of the nose. You want nose symmetry on both sides. Baby has nose symmetry on both sides. And now I'm going to go ahead and check to see how the baby's nose patency is and how they're breathing. I'll go ahead and put a glove on here. Alright, so in order to check this, you're gonna have to close the mouth. And so I'm gonna just place my pinky in the infant's mouth, and then I'm going to occlude one side, one nostril at a time, checking for patency. Baby appears to have nostril patency. At the same time here, I'm gonna be just feeling the palate of the infant, whether or not they have the soft and hard palate. They should have both. And then if they have any sort of defects within their palate. Okay, at the same time as the baby is kind of sucking on my finger here, we can address the sucking reflex. Baby is able to suck okay, so the sucking reflex is intact. Now I'm going to evaluate for the rooting reflex by stroking each side of the cheek. And baby is able to root. I looked at the lips and everything, and that was moist and pink. I did not see any Epstein pearls. Those are kind of the white spots in the back of the mouth. That's kind of a normal finding a lot of the times. So now that the hard palate, soft palate, and everything in the mouth has been assessed, I will go ahead and remove my glove and then look at kind of some features around the neck. So when looking at the neck of the infant, you want to make sure that the infant doesn't have like a webbed neck or anything like that. I'm going to go ahead and palpate. You would extend here, kind of hard with this baby doll, but you would extend and kind of palpate to make sure there's no masses or lymph nodes or anything like that. Okay, and then I'm going to palpate the clavicle. Sometimes when infants are going through the delivery process, they can actually fracture a clavicle, so you want to make sure that those are intact. Infant here is all normal, no signs and symptoms of a webbed neck or anything like that. There's no enlarged masses or lymph nodes. Next thing I'm going to go ahead and do is turn baby's head from side to side. I'm kind of checking for the tonic neck. So if the infant was able to reflex in that way, this is how they would appear. They would kind of have that same side extended. Baby is able to do that, and then go ahead and turn to this side. Baby has full range of motion of his neck, and he is also able to express that tonic neck reflex. The next thing I'm going to go ahead and do is look for integrity of the breast development, just to make sure that the breasts are developed on both sides. We would at this point also measure the tissue blood, which should be 5 to 10 milliliters. I don't have a measuring tape with me, like I said, but in a real event I would go ahead and measure that. Make sure that they're symmetrical on both sides. You want to look for any like extras, as that is kind of like a common finding, or can be. And then assess the abdomen, making sure that the baby has a round abdomen, and the baby does have a round abdomen. I would kind of get down eye level just to make sure that I am seeing what I'm also seeing up here, and it does appear that the baby has normal findings in terms of the abdomen. The next thing you would go ahead and do is assess the umbilical cord. For the umbilical cord, they should have 2 arteries and 1 vein. This is only for babies that still kind of have that intact, or infants that still have that intact. So I would just go ahead and look for those, and it appears that the infant does in fact have both the 2 arteries and the vein. The next thing I'm going to do is I'm going to palpate the abdomen. So with the abdomen, you're going to do a soft palpation first, and then kind of a deeper palpation after that. And you're just kind of checking to see where those borders are in the infant, in terms of like their liver, their spleen, kind of assessing those organs, as well as checking for any like superficial masses. So I'm going to go ahead and start with the soft palpation. Palpate the whole abdomen. And then a little bit harder, trying to identify where the spleen, liver, maybe even kidneys are. Okay, and after the palpation, it seems that everything was intact, so we're good there. The next thing I'm going to do is feel for the infant's pulses. For infants, it's a femoral pulse as well as a brachial pulse. Very good. And both are intact. You would do that for a full minute for both. The brachial is typically harder to find, so sometimes it might take you a little bit longer than what I displayed here. But of course, like I said, just kind of simulating time. And then the next thing you want to do is look at the genitalia area. I said this was a male, so I'm going to look for like descending of the testes to make sure that they're kind of fully dropped, and all of this is going to depend on gestational age, of course. So just kind of making sure that everything appears as it should, and it does. And one thing that's really important to note, or 2 things that are really important to note in terms of GIGU, is the first void as well as the meconium, and when they had that in relation to birth. And the next thing I'm going to go ahead and do is look at the infant's knees, making sure that they're at the same height on both sides, kind of looking for symmetry in the hips as well. And then I'm going to rotate baby and do a couple tests for hip dysplasia. Hip dysplasia is kind of common and something that we need to test for when a baby is going through an assessment. So the first one I'm going to do, it's going to be pretty difficult to simulate on this infant because they don't actually bend at the knees, but I'm going to do the Barlow's test first. And essentially what this is pushing the knees into the chest of the baby, checking to see if you hear any sort of dislocation of that hip. So I'm going to pretend like I did that, pushed him into the mattress. And the next thing I'm going to do is the Orgolani's test. And this is an abduction test. So you would essentially keep your hands in the same position, and you would kind of push outwards with those knees. So in that direction, kind of open them up and lift up. And that would be another check for hip dysplasia. If you hear any sort of hopping or abnormal sounds, it's likely that the hip is dislocated, and you would of course document that. So now that I've done all the frontal assessments on the infant, I'm going to go ahead and turn the infant over. When you're turning the infant over, you want to stabilize the head, and this is not the most perfect example, but you want to just make sure that you have that head and the whole body of the infant kind of intact there. Supported, I should say. So now that the baby is prone, a couple things that I'm going to do is look for the symmetry of the scapula on both sides, and you want to look at the spine and make sure that the spine is fully intact. You also want to palpate, make sure that the vertebrae are all there. You would do obviously your count, your C's as well. And then there's dimples on the lower spine of the baby. Adults have them too. But essentially you're making sure that they're at the base of the spine and that they are close, and baby has both symmetrical as well and close to the base of the spine. And then I'm going to go ahead and look at the gluteal folds. So you want to compare on both sides just to make sure that they are symmetrical. Asymmetry of the gluteal folds can actually be indicative of hip dysplasia, so that's something to take note of. And then now I'm going to go ahead and listen to the breath sounds of the infant. You want to do this anteriorly and posteriorly, so we're going to do the posterior. As we know, sometimes gravity and fluid coincide with one another, so it's very important to listen to the back as well. Next thing I'm going to check is the infant's curvation reflex, and when you're checking this, you want to see a curvature of the spine, so you would pick the infant up and you would, of course, support the head, and you basically want to see curvature of the spine. So the baby would naturally kind of curve towards almost like a ball or a hamster in that sense. And then the next thing is going to be the stepping reflex. So I probably wouldn't have placed the baby back down because I had them up, but you're going to support the baby's head, and you're going to kind of hold them upright here, and they should like start to simulate stepping and walking, and that's very normal and should be expected in a newborn. Now I'm going to go ahead and just look at the shape of the bones as well as range of motion. So you want to actually feel all the joints. You're looking for kind of their presence and any abnormalities, like you should feel symmetry. And it's kind of hard to simulate this in this video, but range of motion of every joint, so you would want to do range of motion of, say, the shoulder, bending at the elbow, bending at the ankles, ankles as well, but also wrists, fingers, can they bend their fingers, kind of do range of motion with every single digit, can they bend their hips, knees, ankles as well, and then you would also check their toes to make sure that they can bend there as well, and just kind of to evaluate their overall range of motion. The next thing I'm going to go ahead and do is count the infant's digits, making sure they have 5 fingers and 5 toes on both hands. You're looking for either an excess of fingers or webbing of fingers or fusion of fingers. But of course, normal would be 5 on either hand and feet. And then I'm going to test a couple of the reflexes here. The first one is going to be the palmar reflex. And essentially, you should place the infant, your hand in the infant's hand, and they should kind of grasp over the hand like this. And then the same thing with the plantar. You would place your finger here, and they should kind of curl their toes around you. For the rest of this, I'm going to go ahead and flip infant over. So the next thing I'm going to go ahead and do is check the Babinski reflex, and essentially you're going to do either that backward 7 or J, and you should see the tonic dorsiflexion with the big toe as well as plantar flexion and kind of spreading of the little toes. This should last up until about a year old and is very normal in infants. You should see that in infants, not so much adults, definitely not adults. And then you want to look at the creases at the bottom of the feet. Make sure they are there and make sure, you know, there's some symmetry to them as well. Baby has creases. And then the last thing I'm going to go ahead and check is the startle reflex or the moral. So you want to grasp the child. There's several ways to do this. I prefer to do it this way, as I just don't like the idea of dropping a baby ever so slightly. Obviously there's no harm, but so you would obviously support the baby and just kind of quickly go down to see if the baby has that reaction of almost shock in a sense, or like surprise, and baby was able to do that. In the event that the infant does not do that, it's possible that the anesthesia is still in effect, so you just kind of want to reevaluate that in a little bit, just to double check and make sure that it wasn't the anesthesia that was affecting that response. So that is it for the newborn assessment. Thank you for watching. And of course, before I end this, I just wanted to say that I would go ahead and perform hand hygiene, you know, make sure that baby was returned to a safe environment.